Thank you for joining us this Thursday for our COVID-19 press briefing. Today, Orange County Mayor Jerry Demings will discuss the new campaign to combat hesitancy, the reopening of the portal to get vaccines, and details regarding other vaccination sites and programs. The mayor will also discuss, as usual, our testing numbers, information regarding the vaccination of inmates, and recognition of a group of communications personnel, professionals at the front line of emergency response who certainly deserve our appreciation. Orlando Mayor Buddy Dyer could not be here with us today, but we do have Dr. Raul Pino from the Florida Department of Health in Orange County here to discuss very important details on infection rates and state vaccinations. We begin this press event with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here today. We will give you a little bit of an update about the campaign we kicked off yesterday. As you know, we kicked off our I Got My Shot campaign, which is in full swing. Some of our personnel are wearing the mask today. I had mine on just a few moments ago. The campaign was primarily put in place to assist us in dealing with the vaccine hesitancy within our community. We want to make certain that we do encourage all segments, all demographics of our community to get the vaccine shot. We are doing that in partnership with the Orlando Economic Partnership, Visit Orlando, Walt Disney World, Universal Orlando, and the Florida Department of Health in Orange County. Dr. Raul Pino has been a good partner in that regard. Our goal really is to debunk any myths about the vaccine and bring in trusted community authorities and turn our residents into advocates for the vaccine. We need your help to be able to do that. We had a great media turnout, and thank you to all of you for coming out yesterday. We could not do this without your assistance. We're hopeful that this campaign will ignite a desire in our residents to get their shots and be part of the community immunity initiative that we have underway. You can get information about the campaign by going to our website at ocfl.net/IGotMyShot. Now for the numbers. 52% of Orange County residents ages 40 and older have had at least one shot of the vaccine. Dr. Pino will get more into the numbers. Of the entire county's population, 28% has had at least one shot. While more residents continue to get vaccinated, the 14-day positivity rate is still increasing. It is now 7.1%, and that's not going in the right direction. 1 month ago, on March the 15th, our 14-day positivity rate was hovering around 5%. We cannot let up in terms of getting people inoculated at this time. The coronavirus is still very much alive in our community. Our Barnett Park is still open for free testing every day at 9 a.m., and we are seeing increased demand at Barnett Park of people who are seeking to get tested. This past Tuesday, Barnett Park, at that location, we tested thousands. We had to close early as a result of the testing that was being done there. Since the start of the pandemic, there have been a reported 130,372 reported cases of COVID-19 within our community. 1,221 residents have died from the coronavirus. Not long ago, I had a conference call with the area counties and hospitals, and they all reported that there's also seeing a slight uptick in the numbers. So let me talk about our convention center. More appointments will be available at the Orange County Convention Center beginning tomorrow morning. Starting at 9 a.m., the Florida Department of Health in Orange County will reopen appointments for COVID-19 vaccinations. You can go to our website at ocfl.net/vaccine. I'm told that there will be some 17,000 potential appointments that will be made available. Hundreds of the appointments will be available each day next week, Monday, April 19th through Saturday, the 24th. To make an appointment or pre-register, you can go on the website, again, starting tomorrow morning at 9 a.m. Okay, let me talk a little bit about the various vaccination sites. As you all know, the state shut down some of the satellite sites this week, but Orange County opened up satellite sites, and one of the sites that will be operating tomorrow will be in the town of Eatonville at the Macedonia Missionary Baptist Church. I want to also stress that the Valencia West Campus site, the FEMA site, the federally sponsored site, continues to operate and will be offering Pfizer at that location. They anticipate up to 5,000 walk-ups per day, and we're told that the availability is going well. Orange County's mobile vaccination program continues to be a success. This is the site at Barber Park. At Barber Park, we're providing up to 1,000 vaccinations per day. As a reminder, if you have an appointment, please arrive during the specific time period. That way traffic issues can be avoided. It is also encouraging news that the majority of those being served at Barber Park are from the surrounding zip codes of 32822 and 32812. So there's a map behind me that you can see there. I want to accentuate the importance of the mapping. This map was produced by Orange County's GIS group based on data that we received from the mobile site that we set up, we being Orange County set up, and we operate that site, so we're using our data, not state-generated data. So I'm also pleased to announce, this is a news flash, that next week we will be moving the mobile vaccination site to the Silver Star Park Gymnasium located on North Apopka Violin Road. So it will do what we were doing at Barber Park this week. Beginning today at 5 p.m., appointments for the Silver Star site will open. The site will be operated by appointment only from Monday, April 19th through Thursday, the 22nd, between the hours of 9 a.m. to 6 p.m. However, on Friday of next week, April the 23rd, it will be walk-up only. So on Friday next week, no appointments will be necessary. Individuals can simply walk or drive up to that location. For more details, again, you can visit our website at ocfl.net/vaccine for more details. We also have updated information for homebound residents. Those residents who, for whatever reason, cannot get out of their homes and go to vaccination sites or testing sites, they can register to get the COVID-19 vaccination by calling 311, or the Florida Department of Health and the State Division of Emergency Management are now handling the homebound vaccination program to make sure homebound individuals can be vaccinated in their residences. Homebound residents will be assisted, however, by our 311 operators to register with the state for this program. You can also find the homebound form to receive vaccine in your home at ocfl.net/homebound vaccine. Once the form is completed, the state should contact you within 2 to 3 days. Again, the state will be sending contracted nurses to homes to administer doses to homebound residents. Tomorrow, the Orange County Corrections Department will begin to offer the vaccine to our inmate population. We expect to administer up to 200 doses the first day. The first group that will receive the vaccine are those with medical vulnerabilities and inmate workers. It is the Corrections Department's intent to deliver the vaccine to those inmates who will remain in the jail long-term and do not have the opportunity to receive the vaccine while out in the community. As you all know, most of the jail population, they are not there for long periods of time. They're in and out. Due to the number of inmates, this initiative will span several weeks. Already, we have vaccinated 24 inmates 65 years of age or older. Chief Luis Quinones is here today. Should there be any further questions about what will be done at the jail? As of 5 a.m. today, the inmate population in the Orange County Jail was 2,428. And let's see. This week is Telecommunications Week. This morning I had the opportunity to go out to our fire rescue headquarters and visit with those dispatchers who take the 911 call. We also had the opportunity to present the 2021 Dispatcher of the Year Award, and that award went to Maureen Grether, who works in our 911 call center for Orange County. Maureen was nominated and chosen by her peers for her leadership, selfless acts of dedication, attention to details, and for her outstanding work ethic. She has been employed with Orange County Fire Rescue for 35 years. And so I joined Chief Jim Fitzgerald and Division Chief Kimberly Stewart-Horan this morning to make that award to her. So we say congratulations to Maureen and to all of our 911 dispatchers in Orange County for keeping our citizens safe and going above and beyond during this pandemic. Also want to mention one other thing. There's a call to people who want to work within our restaurant industry. I received correspondence yesterday from the Sluice Mystery Dinner Show that they are in desperate need of workers. So if you are in need of a job, they are located at 8267 International Drive. I would encourage you to give them a call or go by and apply for the jobs that they have. We know that our restaurants have been hit particularly hard as a result of the pandemic, but if you're looking for a job, they're looking for people to hire. So with that, I'm going to turn it over to Dr. Pino.
Thank you, Mayor. Good afternoon, everyone. So our county has a cumulative 130,366 positive cases, and our recovery rate continues to be 96%. Our positive rate, 14-day average rolling, that is at 7.1. It's a 0.1 lower than the day before. And the deaths are at 1,221. The range 50 to 71 for the new death that we have experienced. I will give you those numbers. And the median was 64.5. Those are 8 additional deaths. There were 5 female, 3 male, 2 black, and 4 white. The ethnicity 4 Hispanic, 4 non-Hispanic, and all of them have pre-existing conditions. Only one was a resident of an assisted living facility. And we always mention these of how many, because there was a concerted effort by the state to vaccinate assisted living facilities. And I'm going to show you some of the data on hospitalization and age. And this is to illustrate that it's important to get vaccinated. Now, things are flipping because of the vaccination in older segment of the population, and I will show you that data when it comes. But it's important to know that people need to get vaccinated, and the getting vaccinated will prevent you from dying or from getting really, really ill from this disease. With regard to the variants, another data that I'm going to show you right here is that the younger you are, the higher percentage of variants we are finding in those age groups. And that's something else that is also flipping. And we have so far reported to us 206 cases. of the different variants. So there is a small increase there. Also, if you can put the other graph, I can take it right now. So we went to the data and asked this question before yesterday. I'm going to explain what this graph means, and it will get better. We asked to the data analytics, is the age of the individual who are getting hospitalized getting younger? That was the question to the data set. So what you have in different colors are the age groups. And in the dark blue on the top, you have 65 years and over. And you can see we start vaccinating on December 26th. And you can see since we start vaccinating, there has been a significant decrease in the representation of that age group in the number of people that are being hospitalized. And that's significant. And then you have the other age group and how they are increasing for 5 to 24 years old, and the number of the percentage that they represent of people hospitalized, as well as for 25 to 49 years old. Next graph. So this one is basically the same, but you do some analytics and smooth the data so that you can clearly see what the trends are. And of course you have here, okay, thank you. So here you have the 65 years and older that we start vaccinating first, and you see a significant decline of what percentage of the hospitalized population for COVID-19 those are representing. And that's a fact of the vaccination efforts that we have engaged. And this is why it's significant to try to vaccinate younger people, because they are not vaccinating at the same rate that we vaccinated the older population. So this is to say that it's important still to avoid gatherings, large gatherings. If you are all vaccinated, it's fine. It is important to continue to wear your mask. It is important to continue to wash your distance, as well as to wash your hands. For the number of vaccinations that we have given in the county, the total number of doses administered in the county is up to 676,753. Orange County residents, of those, 606,601 were given to Orange County residents. As the mayor mentioned, 17.77% of our population is fully vaccinated. That's a good number. And residents that have received more than one dose is up to 28% of our population. For 65 years and older, that percentage goes up to 77.83%. Orange County residents younger than 18, fully vaccinated, is only 193, meaning younger than 18 that have received 2 of the doses or at least one of the Johnson & Johnson. And that number for any doses received, it goes only up to 3,251. Our population of people younger than 18 is close to 200,000. So we have a long way to go into that population. So with that, we continue to be in a good place, but we are in a juncture where we are seeing a significant improvement in the older segment of the population, while the cases and hospitalization are slowly increasing in the younger segment of the population. So this is really a call to get vaccinated, and to get vaccinated as soon as you can. The vaccines are out there. We are, as the mayor mentioned, tomorrow about 17,000 appointments will be opening for next week, and we are engaging in other efforts to bring vaccines closer to our community and closer to the people that need it. With that, thank you, Mayor. Any questions?
And thank you, Dr. Pino. We do have Mr. Scott Howard from the school district here, should there be any questions related to the schools. If there are questions for the Spanish-speaking media, we have Ms. Ilia Torres here to do translation. We also have Chief Quinones here from Orange County Corrections Department. And we have Director Banks here, should there be any other questions. All right, with that, we'll open it up.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. Dr. Pino, can you explain how you plan to work with the county on choosing locations for the mobile vaccination unit now that they don't have direct access to the data they've been using?
So the county will continue to have access to the information that they are going to need to make those decisions. It would be probably, we talk daily. We share information daily on the number of cases and other things that we may see in the data. What is going to happen is, as we develop these plans to go out into the community, we will provide the county with information on where are those sites where we have seen the lowest vaccination rates. We will continue to do that. It's critical to our work.
Una pregunta en español, Edgar Carrillo, Telemundo, puede ser para Dr. Pino o para el alcalde y su asistente. La necesidad de lanzar una campaña de I got my shot, yo me vacuné, responde a una baja demanda. ¿Qué es lo que está pasando? ¿Cuáles son los números en este aspecto y cómo ha afectado la polémica de la paralización de Johnson & Johnson que ocurrió el día de ayer con esa oferta y demanda? Píntanos más o menos cómo está eso, que hubo la necesidad de lanzar una campaña.
So the question is was the campaign launch because you have a special need or you have seen a decrease in the demand for the vaccine? That was the first question. And the second question was how Johnson & Johnson issue that we are facing could affect the distribution of the vaccine. Do you want to take those questions, sir? Or?
I think you got it.
All right. So, en español first, primero. Yo pienso que la campaña ha obedecido y ha estado. Hacer una campaña como esta no es una cosa de 3 días. Este es un servicio que se ha estado programando en los últimos meses. Y la idea, como dijo el alcalde hoy, es llegar a las personas que lo necesitan más. Y también combatir el miedo a las vacunas que muchas personas tienen. Eso es parte de darle un incentivo a la gente a que se vacune y dar una representación gráfica que los ayude a tomar esa decisión. Con respecto a Johnson & Johnson, we didn't have that many in existence. No teníamos muchas que pudiéramos distribuir porque estaban principalmente localizadas en el federal site. No nos ha afectado la distribución. Por supuesto que tal vez tengamos que estar un poquito más apretados en el Pfizer porque la estamos usando más, pero tenemos los volúmenes suficientes para las próximas 2 semanas de operaciones, como el Estado nos ha estado ofreciendo el soporte. Hasta ahora bien, yo creo que cuando abramos mañana va a ser una mejor indicación de cómo está la demanda. So the answers in English were that the Johnson & Johnson issue have not affected distribution of the vaccine in our county, in our operation, because we were not doing, to begin with, that many Johnson & Johnson. The federal site was the one receiving here most of the Johnson & Johnson, and we have about 30,000 Johnson & Johnson in our possession that we are holding until this issue gets determined what to do and what to do with that vaccine. If there's, send it back if it gets recalled, or continue the distribution, which I think may be the case with some modifications. With regard to why the campaign was created, it was not in response to a specific issue. A campaign like this takes time to work in it. It was also with the effort and the insight that people in disadvantaged locations for transportation and economic challenge, as well as fight vaccine hesitancy and provide people with a closer approach to the vaccine, bring it to the home, bring it to the neighborhoods, and also by people who represent them as well.
Dan Messini with News 13. My questions are for Mayor Demings. Mayor Demings, does Orange County no longer have access to the statewide COVID-19 database? If so, what's the reasoning? And will this hinder your efforts to vaccinate the hotspots within the county?
We no longer have direct access to the information that the state was keeping in their database. However, as Dr. Pino indicated, we do communicate with Dr. Pino on a regular basis. But we also receive and collect information from various other sources about the need for those who want to be vaccinated within our community. We get it from emails, other elected officials, or other trusted sources in the community who communicate with us. So this week, this was the first week that Orange County took a site, Barber Park, where we are essentially controlling that site, managing and operating the site fully, and collecting our own data. So intuitively, because we do know our community, and this has been part of my advocacy since we started the pandemic, those of us who work at the local level, we know our communities. And because we know our communities, we really know where we need to locate within our community based upon the various feedback that we are receiving. So we are strategically going to move throughout the county into some of those underserved areas. And as I announced earlier, we will be moving into the Silver Star location next week because, again, the data indicates that we have lagged there, and no one had to really tell us that per se, because we have been active. Our personnel have been on the ground, the firefighter, paramedics, and nurses and other health care staff, they've been on the ground. So we hear it. I move throughout this community in a number of different settings, and I get feedback. So we are using all of that to help us manage our response efforts. No.
Lara Greenberg, Fox 35. This question is for Mayor Demings. You mentioned the FEMA site now doing Pfizer. Can you speak a little bit more about that, how that's going, and how much distribution is happening there now?
The demand for the FEMA-sponsored site is still significant. They are doing thousands a day at that location, which is good news that people still want to get vaccinated, even with, you know, a little bit of the bump in the road we had this week with Johnson & Johnson. Johnson & Johnson was primarily going to be used in those underserved areas so we can go in one shot and we wouldn't have to worry about that person scheduling a second shot. For some of the homebound individuals, it would have been perfect for those. So we remain optimistic. Again, on the regional joint call we had earlier today, we had physicians from our largest hospitals on that call. What they're saying to me is that we do anticipate that Johnson & Johnson at some point will come back online. But I also, earlier today, was on a call with a briefing from White House personnel, and there is adequate supply of Moderna and Pfizer to take up the gap, if there was any, that was created by Johnson & Johnson coming offline. So that's good news for our community. And in terms of the allocation for next week, the allocation from the federal government to the state has increased significantly. So we should be able to meet all of the demands within our community.
Nikki Zizaza with News 6. This question is for Mayor Demings. Mayor, so why did the State Department of Health, ban the county from having access to that database? Was there some kind of agreement that was violated that would put the county in that position?
No, we have a good working relationship with Dr. Pino. He is a state employee, and I think in the spirit of working in collaboration and working in partnership for the best interests of our residents, we were given, at least one of our employees was given access to be able to review the data in the state database. But it's the state's database. So they have not given us a reason. The only thing that through some public records requests, we are trying to be as transparent as we possibly can. We're going to always be responsive to lawful public records requests, and we'll produce those records. And it will have to be the state that will respond. Did that cause them any concern about if they had to produce records for the entire state? I can't respond in that regard, but I have to underscore the relationship that we have with Dr. Pino. It's been a good relationship, and perhaps sometimes, Dr. Pino, in the spirit of cooperation, he goes above and beyond. So there's nothing that happened here as a result of what was going on at the local level. Perhaps someone from the state offices has some concern about that, and perhaps they will give us access again. So what I'm saying to you also is that whether we have access or not, the residents of Orange County are not going to be harmed by that, because we still have access to other data. We know our community, and we're going to continue ensuring that the public has access to getting vaccinated if they so desire to do so.
Amanda Dukes with West 2 News. And Mayor, this is for you. You had said on Monday that you are actively working on a plan to possibly phase out some of the social distancing and masking requirements. Is there anything new with that today? Or when do you think you'll be sharing some more information?
We have continued the dialogue. We have continued to work with our epidemiologists and experts here in the area who have done research. We've continued to work with our local Department of Health and Dr. Pino. And likely sometime next week, we will announce a plan of action going forward about what we can do as the virus continues to affect us here in this community. So next week.
This is Kelsey Thord with West 2 News as well. This is also for Mayor Demings. Mayor, you've talked a lot. I mean, we definitely have a lot more vaccination sites now than we did even a couple of months ago. And now that we're using mostly Moderna and Pfizer came out today and said that most likely people are going to need a third vaccine within a year. Do you think that we're still going to be having county-run sites in a year from now? How long are you expecting this? Or do you think it's going to be phased more into the private, pharmacies, CVS, Walgreens, that kind of thing?
Because of the sheer volume that we're talking about of Americans that will need to either receive a third dose or otherwise, it's going to require some collaboration, federal, state, and local, to make this happen. And I don't know that the private sector alone could handle the total demand. So more than likely, this is my opinion now that I'm offering, it will require some level of government to be involved in assisting, just for efficiency's sake, to get the number of people access who would need access. Otherwise, if it was just purely the retail outlets, the hospitals, or the community health centers, I think it would, when you're talking about all Americans, that will overwhelm those systems, I believe. So I think that you're going to have some other efficient operations. When you look at our community, the regional asset that we had at the Orange County Convention Center has proved to be very beneficial. It was an efficient operation that we were able to get people tested in significant numbers. We were able to get people vaccinated in significant numbers. I don't know that there is any alternative to that alone, but through, I think, a multi-pronged strategy, we would be able to efficiently deliver the doses that is necessary here in Florida and within our community if we all work together.
This is Melissa Thomas with Florida National News. I'm in the back, always in the back. I'm not quite sure who this question is for. This could be for you, Dr. Pino, or Sergeant Quinones, Mr. Quinones. But with your announcement of the inmates that are of the older age about to get vaccines, as well as the workers there, I did have a question about the sort of reduction in age for the positive cases that we saw over spring break weekend. And I know you guys talked about how there is a flow of inmates coming through there. So did you guys start to see a younger age population in the jail or with positive cases of COVID-19? And will that move up the timeline for those younger folks to get the vaccine?
What I would tell you about our jail population Probably 61, 62% of our jail population is between the ages of 18 and 34. They're young people. When you start getting into the 65 year of age and older, that's not the majority of people in our jail. You know, it's a young demographic, but we, with limited inventory of the vaccine, we chose to provide the vaccine to the older inmates first. We started there, and now we're making it available to other inmates. And again, I want to remind you that people who come into a local jail, typically their sentences are far less, 1 year or less. Most of the ones who enter the jail, they bond out, they're released. Very few of them are there for longer periods of time, but there are some. Chief, in terms of the felony people who are in your jail, what is that, about 20% of the jail? About 20% of the jail population are there on felony charges. So everybody else who are there on misdemeanor charges, they're pretty much in and out.
And Mayor Ryan Gillespie at the Orlando Sentinel, this is for you and Dr. Pino as well. Some of that zip code data that you released yesterday, some of the zip codes and parts of town that maybe are lagging in vaccination rates have had, you know, sites nearby and pop-up sites, whether it's through the state, you guys, the federal government. How do you ensure that when you're setting up sites in these areas that you're reaching the people that you're trying to reach in some of these underserved communities?
Well, the proof's in the pudding. You know, one of the maps that was up there earlier today from Barber Park, if you saw the heat map, you could see that the zip codes were of the individuals who were vaccinated at that site came from that immediate area. And that was a target community that we wanted to be in. That was a community with a significant Spanish-speaking population there. We wanted to reach that particular demographic with that mission, and we were successful in ensuring that the people who lived there in that area were the ones who were indeed getting vaccinated. And some of the other sites, you know, the regional site that was set up at the convention center, the people could come from any county, anywhere within the state of Florida and actually get vaccinated there. However, the overwhelming majority of people who were vaccinated at the convention center over time were Orange County residents. But there were residents from all the other counties who got vaccinated there as well. Okay. That looks like that's it. There are no other questions. So thank you all for joining us today. The next press briefing